In the middle of Athens, a little table on the side of the road is saving lives every Wednesday and Saturday afternoon. Access Point of Georgia is one of only 2 syringe service programs in the state. Riley Kirkpatrick helped start Access Point. Not only is he a certified peer specialist at Alliance Recovery Center, but Kirkpatrick is in recovery himself.
We give them every single part of supplies for them to be able to shoot safely. So people can put their dope inside of the spoon, use these waters, right? And we say on the waters to make sure that they don't share it with anyone else. So the half inches are longs and these are shorts. So they can essentially choose what kind they use.
The concept is simple. People in active drug addiction can stop by to exchange their old needles for new, clean ones. They can also pick up free condoms in order to stop the spread of HIV throughout the community.
How you doing? You got any dirties?
Access Point also supplies fentanyl test strips to make sure any opioids don't have other drugs mixed in. And it gives out free Narcan, an opioid reversal drug.
We only started doing street outreach in November, so it hasn't been very long at all. But we're killing it. It's going so well.
People travel from all over the state to come to the table, Kirkpatrick says. Since January, he has saved every box of syringes the organization has given out. Each of the boxes represent 100 needles, which means Access Point has given out more than 5,300 syringes since it started.
That is 5,300 times that someone is not spreading HIV or Hep C.
While the COVID-19 pandemic ravages communities across the globe, another health crisis continues to plague the United States. The opioid epidemic has affected millions of lives as more and more people are getting addicted to harmful substances.
Opioid use steadily increased during lockdowns and quarantine. Despite this growing issue, only 2 syringe service programs operate across Georgia. Athens, a major hub for substance use treatment, houses one of them.
We're seeing a lot more use in the last year.
Allie McCorkle worked alongside Kirkpatrick to help start the volunteer-based syringe service program. She also works as a treatment provider at the Outpatient Treatment Center Athens Clinic.
My favorite statistic is people that access harm reduction programs and syringe service programs are 5 times more likely to go to treatment. So that is one of the resources that we provide.
Although Access Point saves lives, some people think similar programs may be doing more harm than good. Syringe service programs are met with opposition that argues giving out clean needles enables people with substance use disorder. In other words, some think these programs simply allow people to continue using drugs.
I understand that they're controversial, and I really think that that's because people don't understand what it is that we do. There's been enough research and enough statistics out to know that it doesn't make drug use any worse, but it does minimize the harms that are done as a result of drug use. And I think the biggest thing that we're seeing is we're the only ones in this community that reaches out to active users. Like people who are actively using drugs, there's absolutely no resources for them, nothing. And all that they do is get turned away and get judged.
Access Point aims to help people who are still struggling with active use, but the organization hopes that the people they're serving will eventually enter treatment. For now, Kirkpatrick and McCorkle want to keep them alive to give them a chance to make that choice.
Overdose deaths are preventable.
Access Point currently operates entirely with volunteers and donations, but McCorkle and Kirkpatrick hope that the program will continue to expand. With more community support and the introduction of more syringe service programs, they are confident that organizations like Access Point can save lives and start to remedy the damaging effects of the opioid epidemic. In the meantime, the organization is looking for volunteers and donations to help continue the work and expand its efforts. You can learn more at accesspointga.org. For Grady News Source, I'm Sam Perez.